we'll start looking at the teeth directly and how it looks like. Now, if we introduce the different types of teeth, and I'm sure this is common knowledge, especially from your primary school or high school, depending on where exactly you did it. We have different types of teeth, okay? And I think we all know we have incisors, we have canines, we have premolars, and we have molars. Okay, so these are the 4 main groups. And depending whether you are having primary teeth, whether it is primary teeth or even secondary, like now in children who have grown up, regardless, they will have all these pairs of, all these types of teeth. Okay, they might not be the same number, like in primary, or even as compared to secondary, but all these must be normally there. Okay, so let's start off with the incisors. And the incisor is the one that normally you find it in the anterior most part, okay, of our teeth structure. So it is at the front of the mouth, and they normally have very sharp biting surfaces. So if you look at it from the side, this is a side view. Okay, you can see how sharp that is. So, and the sharpness is normally for biting. Okay, and they are used for cutting or shearing food into smaller chewable pieces. So there are 8 incisors in both primary, that is in babies, and a permanent set of teeth. So both babies, that is in primary, we have 8 of them. That means it's 4 sets, that is 4 pairs. Okay, so even in secondary teething, then we have 4 pairs also. That means that we have 4 in the upper jaw, and then 4 in the lower jaw. So in total, they make 8. Okay. So the most important thing here for you to understand is that, one, they are very sharp, and the purpose of the sharpness is to bite, and also, first of all, because it's the very first teeth to encounter whatever you're getting into the mouth, whether it's food or whatever, whichever chunk of food you're putting in, they're the first one that actually cut them into smaller pieces. So they cut everything into smaller pieces, so that now the rest of the teeth can do the other function, like maybe even grinding into finer pieces. So this is how it looks. As we said, it's very sharp. This is now an anterior view. Okay, this is a posterior view of that of the teeth, of the incisors. Then this from the side. Okay, so that is the incisors. Then we go to the next group, or the next category, and the next category is canines. So we finished with the 4 top and 4 at the bottom, which are incisors. Then we go to the next one. The next ones are canines, and these are very famous kind of teeth. I think you have seen, like in vampires, the movies, for like every vampire movie, the canines are the ones that are normally elongated. Okay, and they're not so many. We only have one, like two pairs in every jaw. Okay, so you have 2 in the upper jaw and 2 in the lower jaw. So the canines are situated at the corners. Okay, so just remember canines and corners of the dental arches, and they have a very sharp and pointed biting surfaces. Okay, so their function mainly is to grip and tear. Okay, so again, get the difference. You see, incisors, their function is basically to bite and also cut. They're also sharp. Okay, so no big difference. But the canines, their function is not only to cut, but they grip. Okay, they hold whatever they are trying to eat, like in place, and then they tear it. So you'll see sometimes when you're eating like very hard meat, okay, let me not say there's no hard meat, meat that is rare cooked, okay, that means it's still very hard to chew out, okay, then it's not very tender. So what you do with such meat, you try to place it at the corner of your mouth and you try to tear it. Okay, so I'm sure most of you have tried to do that, and that is because that is normally the function of the canines. So there are 4 canines, canine teeth, that is in both primary and permanent dentitions. Okay, so both children who have the primary dentition and the other ones like adults or older children who have had their permanent dentition, both of them have 4 canines. That means 2 in the upper jaw and 2 in the lower jaw. So, and you can see the structure. This is an anterior view and this is a posterior view of the canines. Okay, so even the like dogs and everything, when they're eating their meat and other thing, they usually hold it with they usually hold it with the canines. Okay, then we go to the other ones, the premolars, and now we're finished with these 1 and 1, that is canines, and then these 4, these are incisors. Okay, then you have premolars. Okay, so the premolars, unlike incisors and canines, they normally have a very flat biting surface. So remember when we said canines and the incisors, these ones have a sharp biting surface, or the crown of their teeth is a bit sharp. Okay, that is how their crown is. So it's a sharp crown. But when you go now to premolars, you'll find that they are now their surface is a bit flat. Okay, it's not as sharp as the incisors of the canines. So the function is to tear, but most importantly is also to crush. Okay, and you need something that is flat to crush things. So whatever you took in food, which is a big chunk, it goes to the incisors first. It is cut into tiny bits. Okay, also in the canines, they tear it apart and everything. In the premolars, now the smaller chunks are now crushed, and you need something with a flat or a larger surface area for that. So they are unique to the permanent dentition, which has 8 premolars. Okay, so you'll find there's a difference between in a primary dentition and in a secondary dentition. So they're unique in the permanent dentition. So you'll find them in a secondary dentition. Okay. And that is why you'll find that kids, you don't give them like, I don't know if you've ever tried, you give a child like meat, okay, something that now needs crushing, or some food that is a bit hard, okay, that needs some serious crushing. Children will not be able to do that. Okay, a classical example is like a chewing of sugarcane. Okay, like the sugarcane itself. You'll bite it, then you will take it to the back of your mouth and start crushing it so that it releases the juice. Okay, now that can be done by an adult. I will find in very young children, they cannot do that. They cannot crush that sugarcane, and the reason is because the premolars are not there. Okay, they do not have premolars like the adults, so the crushing is a bit hampered with. Okay, so they don't have the same number of premolars as adults. So that's an important aspect you should know. And that is one of the reasons when you're trying to introduce children to food, you start with light food mostly. So it will be breastfeeding exclusively. Then you get to weaning, where you start introducing some light food. Okay, that is porridge, other cow milk and other things, and then giving them soup. Then trying to give them mashed potatoes or other things that are a bit lighter. They do not need crushing. They have already been crushed for them because of this dentition problem for them. Okay, so that is it for premolars. So, and as you can see, how many do we have? We have 4. We have 4 pairs in the upper, and then 4 in the lower jaw. So as if we continue counting whatever we are counting in terms of numbers, then incisors we have talked about, we have a total of, okay, let's do for per jaw. So we have 4 incisors. Okay, then canines we have 2. Okay, then now premolars we have 4 of them. Okay, then we proceed. So the final set of teeth that we have in our dentition, they are called the molars, okay? And they are the largest of the teeth. As you can see, the size of the teeth increase in size as we go deep into the mouth, okay? So they have a larger biting surface, and the main thing here, the same with premolars, which have a large, a flat surface, but now molars have an even larger. They have an even larger surface because of their size. So they more or less will do what premolars do, okay, like tearing or crushing, okay. But on top of that, they can do grinding, okay. I know you know the difference between crushing and grinding. Crushing is, in simple terms, if you have, assume you have two crushers or two things that are coming opposed to each other. So when they hit each other directly, that is crushing. They crush whatever that is inside. Grinding is the same two crushing elements or two things that are coming together, in this case the teeth. Now on top of just hitting directly on each other, they also move side to side, okay. So they grind, okay, they grind on each other. So that is an additional function, and that now enables to make the food even finer, okay, and easy for now not digestion, for easy uptake in terms of it going to the esophagus and going down, okay, and also easy for digestion because it has been put into very small and fine structures. So there are also 8 molars in the primary dentition, okay, and there are 12 in the permanent dentition, okay. So as you can see, 1, 2, 3, 4, 5, 6. So we have 6 pairs in an adult dentition or in a permanent dentition. So again, if we continue with the calculation, incisors we have 4 of them, 4 pairs. Canines we have 2 pairs. Premolars we had 4 pairs. Then molars we have 6 pairs. Okay. So if you do simple calculation, so if you were to do the calculation, the 4 incisors plus the 2 canines plus the 4 premolars plus the 6 molars, then what we should be having is a total of 10 plus, have I calculated well? 6 plus 4, 10, 10 plus 6, that becomes 16, and its pairs multiplied by 2, we have 32. Okay, yeah. So that is what basically we will be having. That is what we will be having when we are talking about the issue of the teeth, the amount of teeth that we have. Okay, so if we proceed now with that, and we look at it now, you notice that I'm trying to give you some comparison when we're talking about primary teeth or primary dentition and the permanent dentition, which is the secondary teeth, because I don't think you'll get another opportunity to look at both pediatric dentition, oral health, and also now the adults that we're looking at. So it's good I just give you all of it. So as I said before, incisors for primary teeth, we have 4 pairs, the same with secondary teeth. Canines, we have 2 pairs for primary, and we have 2 pairs for secondary. Premolars, we have no premolars. They're only unique to permanent. And you'll notice, if you're also keen, you can just check also on the side of the jaw of children, and you'll find to see that their premolars are not there. There's usually like a gap there. And then premolars for secondary or permanent teeth, we have 4 pairs. Okay, so you can see 1, 2, 3, 4. And then finally, the molars, we have 2. We have 4 pairs in children, and we have 6 pairs in secondary dentition. So normally, a child or primary teeth will ultimately be how many? So we have 4 plus 2 plus 4, that is 10. Okay, 4 plus 2, 4 is 8, plus 2 is 10. For these ones, we'll have 4 plus 2, 6, plus 4, 10, plus 6 becomes 16. So multiply by 2, we'll have a total of 20. By 2, you'll have a total of 32. Okay, and normally that is the difference in dentition for primary teeth and primary dentition and permanent dentition.